I realize that lately I've been seeing a lot of people walking around wearing face masks. Masks again. Now, granted, we were in Tennessee and now in Georgia, and I don't think that these states have enforced mask mandates yet, but I think that's the key word, is yet. Because according to what I'm seeing, mask mandates are being reinstated around the country, and it's only a matter of time before this becomes nationwide. New COVID map shows states with the highest cases as hospital mask mandates return. And apparently it's back. It is back. Americans are furious over this, and they're voicing their concerns and opinions. I'm reading comments here. It says that I hang out at a friend at work. I hang out with a friend at work, her work, for about an hour every day. They all developed the flu over the holiday weekend. I did not, thankfully. They had it pretty bad. They don't have other medical issues, but I do, diabetes. Thankfully, I was the only one that didn't contract it. I have been very lucky in the past couple of years to not have gotten the flu. I've had some sinus issues lately and a slight cold once this year. I've had the first two C19 Moderna shots, but will never take another one. They lied about them. Interesting they mentioned Moderna, because I'm going to share with you some shocking information about Moderna that happened just the other day. And this one here says, I just got over RSV. Now, folks, please do not take it personally if I do or do not read your comments. I get a lot of comments, but I try to narrow it down to the ones that are going to be most closely related to the context of the conversation and the information, breaking news, and important updates, alerts that I think are most important. So this one says, my friend's kids gave it to me. It's super contagious. I've been isolating for nearly a month now, and I haven't spread it to anyone, or so you think. And I don't think a mask would help with it. When you get coughing, it's some hard coughing. Germs go everywhere, and I've just been staying away from people, and no one has gotten sick from me. So with that being said, I've noticed a lot of people wearing masks. For sure. But I've also noticed a lot of people, which I don't know, I find it kind of odd that when people are out in public and they choose to cough, how they just kind of like do it openly and freely. And usually, like, as they're entering in a building and grabbing a door handle or something like that, and I'm like, can we not spread all this to everybody walking in? Maybe it's just me. Maybe I'm just overreacting. Another one here says, I work in a hospital. People are trying not to come in due to high wait times and no rooms. Again, we're having a shortage of availability in hospitals and hospital staff, especially if you're in the northern part of the country. You guys are aware of the increased volume due to the cyber breach and cyber attacks that sent Canadians down into the U.S. to go to hospitals. And that created a shortage due to the higher demand of available rooms and staff, medical staff. But it says we're constantly busy. If we have another pandemic, our healthcare system will most likely collapse. Yeah, and then we'll see the fallout and the anger, and fueled by fear and panic from people when that happens. If the Rona is going to come back, this one's actually kind of funny. This one says that if the Rona is going to come back every 4 years, maybe we should shift the election to an off Rona year. It's funny how that happens, and ultimately has an impact on the influence, the political influence, the current administration, the potential running candidates, but also the availability and ability for folks to be able to get out and vote. And now it's not even a matter of preventing people from voting. Now it's a matter of preventing who is available to vote for. For instance, a potential Republican candidate being removed from state ballots, legally, illegally. There's a gray area there. But not to get sidetracked, as far as this mask mandate and this widespread massive outbreak of illness, I've got one here, and it simply just says, it's in Tennessee now. And yeah, I think that they're a little alarmed and worried about that one. It's in Tennessee now. If you're in Tennessee and you're seeing it, let me know. I did notice some folks on Broadway. It is oddly enough, we were walking down Broadway. Michelle got a pair of boots. I think she's going to show them on Squirrel Tribe 2.0. And we were hanging out with some friends, this, that, and the other. And it was just interesting that on Broadway we were seeing folks wearing masks, and I was just like, man, you know. But as I said, some shocking news that came out just on Friday, just 2 days ago. Moderna's stock, Moderna Incorporated, according to Market Watch, their stock rises on Friday. Not only did it rise, it outperformed the market. Moderna's stock outperformed the market. So what does that tell you guys? Okay, the writing is on the wall. Yahoo Finance shared that in the latest market close, Moderna mRNA reached $99.45 with a positive upward movement compared to the previous day, and the stock's change was more than the entire S&P 500's daily loss. The biotechnology company's shares have seen an increase of nearly 30% over the last month, surpassing the medical sector's gain by a long shot and the S&P 500's gain of only 5.24%. So not even 5.25%. So oddly enough, people are getting sick all over the country, and mask mandates are now being imposed. And also, mRNA, Moderna Incorporated's stock price is going through the roof. Okay. Yeah, I don't really think you can make this stuff up anymore. COVID mask mandates return to hospitals in 5 states so far. And I've got a COVID map that shows states with the highest cases as hospital mask mandates return. So you guys, it says that the percentage of the Rona nucleic acid amplification test, NAATS, in the past week by HHS region, United States. And as we progress here in the color range, the green is the lower percentage and the orange is the highest percentage. And you can see where it's being focused and concentrated right now. Hopefully you guys can see that. So please pay attention for the folks living in those states. Meanwhile, across the U.S., they are reinstating mask mandates as the JN1 variant becomes the dominant strain spreading throughout the country. Places like California, Illinois, Massachusetts, New York, and Washington, D.C. have all brought back divisive rules, meaning masks are mandatory. And this Centers for Disease Prevention and Control has recorded, CDC, recorded a 10.4% increase in C-19 hospitalizations across America. There's been an increase of 3.4% in deaths in the same period. And extremely important here is that the mask mandates have long been controversial since they were implemented during the C-19 pandemic. You guys remember that, right? And this reached the U.S. in the early 2020. Medical professionals and the CDC have consistently advocated for mask wearing, including outside of doctors' offices or hospitals. And they're talking more here about mandatory mask policies for indoor and outdoor settings. But you guys probably will agree with me about how we feel about the effectiveness and the possible negative consequences and drawbacks of the mascaroos. Besides the fact that people want you to buy more masks. This week, General Brigham the largest health care system in Massachusetts, said that effective January 2nd, January 2, so that's going to be on Tuesday, masks will be essential until respiratory illnesses fall below a certain percentage. Mass General Brigham said that its policy is determined by the percentage of patients with respiratory illness symptoms presenting at emergency departments or outpatient clinics. And you can see this lovely young lady here all masked up and ready to go. You know, so she looks super excited about this. Maybe after this she's got a side hustle where she does asbestos abatement or something. 'Cause that mask looked pretty serious there, pretty commercial grade. The hospital said on its website, we check a number of different data points, including rates of influenza like illness, staff absenteeism, and emergency room visits and hospitalizations caused by respiratory viruses, and we will lift the mask requirement when these data points remain consistently lower. In New York, NYC Health Plus Hospitals has said there would now be a mask policy in place at all of its facilities, adding to its website that C-19 and other respiratory infections continue to pose a threat to all New Yorkers. Hospitals in California are also asking patients, workers, and visitors to mask up. And officials in Yolo County said in a news release that due to a rise in respiratory virus activity in the community, individuals should consider wearing masks in crowded indoor spaces. Amy Sisson, Yolo County Public Health Officer, said, our wastewater monitoring program is currently detecting high C-19 and RSV levels. I recommend that everybody in the community take steps to protect themselves from infection, including wearing a high-quality mask when indoors around others. Marin County Hospital hospitals, plural, have had a mask mandate in place since November 1 of this year, 2023, and Santa Clara County masks have been required since April 4 of 2023. In San Francisco, masks are required in hospital settings for all workers in medical fields and in prisons. And you can see they got the signs up there telling you, reminding you, hey, put that mask on, Joker. The flu season, when respiratory illness, including C-19, rise in the winter, has led to some hospitals in California, Illinois, Massachusetts, New York, and Washington, D.C. bringing back mask mandates. And they're probably just going to get more and more strict on these. Meanwhile, licensed healthcare facilities that are subjected to the mask mandate include general acute care hospitals, skilled nursing facilities, including subacute facilities, intermediate care facilities, emergency medical services, EMS provider agencies, congregate living health facilities, chemical dependency recovery hospitals, acute psychiatric hospitals, dialysis centers, home health agencies, primary care clinics, ambulatory surgery centers, hospice facilities are on the list. Recommendations here, they say, stay home if you're sick or showing symptoms such as coughing, sneezing, or sore throat or fever. Immediately test if you have symptoms or were exposed to C-19, the Rona, especially before visiting those who are vulnerable or immunocompromised. Wash your hands often. Wear a well-fitted, high-quality mask to help protect against transmission in crowded indoor spaces. And again, this happened right before Christmas is when this really started ramping up. And it's only going to get worse, folks. It's only going to get worse. And it says that the Boston Public Health Commission said people should consider wearing a mask in crowded indoor settings. They are also urged everyone to stay up to date with their jabs against the C-19, Rona, and the flu, and stay home if feeling sick. They're urging, I'm going to read that again, everyone to stay up to date with their jabs. And if you guys remember earlier in the video, I was explaining to you the profitability behind Moderna and their recent stock uptick on Friday. According to the latest C-19 wastewater tracking data from the Massachusetts Water Resources Authority, Rona in the Boston area is at its highest levels since last year's holiday season. Earlier this week, the CDC said that the new variant JN1 now makes up about 44% of the Rona cases, C-19 cases across the country. You saw the map, you're hearing the news, we're reading the headlines together, the writing's on the wall, shit is hitting the fan, folks. and it's only going to get worse. Please be aware. Please be safe. Please be careful. Please wash your hands, and please smash that like button and subscribe to the channel if you haven't already. Thanks for watching.